Study suggests high activity levels related to higher cognitive performance in the frontal, temporal, and parietal areas. We already talked a little bit about the frontal lobe, about the prefrontal area. The frontal lobe, of course, is associated with motor functions. And this is what links your prefrontal area and your motivations to the action of getting things done. And this is how a big aspect of helping people in your practice. You will see a lot of people every day, again, with fatigue and depression. Minimum one person a day. When you see these people, you're going to see that they're like a lizard sitting in the hot sun. You can't get them to do anything. They have no motivation because of reduced frontal activity. The temporal and parietal areas are a lot more complex, and I'm kind of reluctant to get into these, but they relate to visuospatial issues, proprioceptive functions, emotional issues. The temporal lobe, in particular on the right side, is highly affected with the limbic system. The limbic system, of course, fires very strongly into the frontal lobe. So you're going to see very big changes in behavior and personality. It's that ability of the frontal lobe to function properly that helps people to maintain socially appropriate behaviors. The limbic system, of course, is related to functions of food, sex, and fear. And so a lot of the times people will have these drives and you'll say, yeah, I want those things, but your frontal lobe says, well, it's really not a good time for that right now. It's not appropriate. I want to act on that, but you know what? I'm going to just dampen that activity down. And you're going to see a lot of people, traumatic brain injury, depression, they lose this ability. They start to just blurt things out in socially inappropriate ways. They start to have problems at work. They don't have the motivation to do a job, or they fail at their job because they lack the ability to organize. And you can use a simple skill like exercise to improve these things. And you have to remember, for those especially who are inclined to nutrition, that the brain not only relies on the soup, but it relies on spark. So we have to be able to incorporate both. Resistance training program over 26 weeks improved associative memory performance, led to higher activity in frontal areas and those other areas there as well. Now, this is a very important point, especially for the naturopaths in the audience. Studies observe more pronounced activity in the hippocampus. What does the hippocampus do? It's associated with memory and what else? Circadian control of cortisol. The adrenal glands are simply responsible for synthesizing cortisol. They do not control when it is released. Okay, that's a very important point, because when you're looking at a salivary profile and you see an impairment in cortisol function, what you're looking at is an impairment in hippocampus function. And if you just simply focus on nutritional interventions to stimulate adrenal function, you're going to have a poor outcome. What you need to do is figure out a way to normalize the function of the hippocampus. And because there are people here who may not be familiar with this, what's the clinical sign of somebody if they have low cortisol in the morning? They don't rise their cortisol? They can't get out of bed, right? And if their cortisol spikes, it leads to insulin resistance. They start to get tired after they eat. If their cortisol spikes at night, what happens? They wake up. If you start to see these things in your clinic, and then the person forgets to bring in their forms, or it takes a really long time to do their history because they're forgetting things, you have to start to think about and link it to cognitive decline and potential early dementia. And again, you have a tool here to increase that spark, to drive that, to correct it. It's increasingly evident that moderately high and high intensity exercise stimulates the release of opioid peptides. Now, what do opioid peptides do, and what does this mean to us clinically? Opioids will cause a reduction in pain. It's a descending pain control mechanism. So you're dealing with chronic inflammation, chronic pain. Here's an easy way to increase opioids to reduce pain. As a simple rule, you have to remember, if you have chronic pain patients and they're not moving, they will not get better. It's as simple as that. They have to incorporate movement in their treatment Nutrition and manipulation is not going to cut it. Opioids will also increase the stimulation of T regulatory cells in the immune system. So this is a very important point when you're looking at people, again, with chronic pain, chronic inflammation, autoimmunity. You're going to look at people who have imbalances in their Th1 and Th2 systems. And one of the biggest things that we need to do is normalize that immune function in order to control that inflammatory or autoimmune process. And exercise is a really, really good way, in addition to some of our nutritional interventions, to increase that opioid function. The duration of exercise for these events to occur is not dependent on time, it's dependent on intensity. So I showed you a study already that showed 3 minutes of boxing or biking was enough. Most studies will show you that 1 to 4 minutes is the range that you need. And what you need is exercise that's over 70% of your maximum heart rate or over 75% of VO2 max. Brain-derived neurotrophic factor levels are significantly elevated in response to exercise. Here's another hugely important point. Brain-derived neurotrophic factor is linked to helping neurons grow. It's linked to increased synaptogenesis, plasticity, maintaining the health of neuron membranes, reducing the risk of neurodegeneration. I've already talked a little bit about how much neurodegeneration we see in our practices, and this is a really important way to help people. You see an aging population. Increasing brain-derived neurotrophic factor is going to be a very important function because that's going to start to decline with age. And here we start talking about some of the suit. Exercise increases serotonin. I'm sure everybody knows that there's nothing in the literature that's been shown to be more effective at helping depression than exercise. That's heavily linked to what we talked about already, increased activation of the frontal lobe and stimulation of serotonin. Getting into the physiology of serotonin is a little bit important here as well, especially for some of the people who want to emphasize more of the nutritional aspects.